Hello everyone, welcome. I'm Dr. Shefal Halim and today I'm going to talk in brief about the important lysosomal storage diseases. So, lysosomal storage diseases are some disorders which occur due to a specific deficiency of specific lysosomal enzymes, which leads to accumulation of abnormal metabolite of that enzyme. So there are two main categories of lysosomal storage disease. One is sphingolipidosis and another one is mucolipidosis. So among the sphingolipidosis, there are 6 common diseases which are important. Among those 6, 3 are very important, which are Tay-Sachs disease, Gaucher disease, and NiemannPick disease. The less important diseases are febrile disease, Krabs disease, and metachromatic leukodystrophy. Among the mucopolysaccharidosis, you have 2 common diseases. One is Hurler syndrome and another one is Hunter syndrome. So the big picture of sphingolipidosis is here shown. And I will not go into details here. I would just like to give you some clues to how to remember those pathways. So first, if I ask someone, hey, someone who is named Niemann, hey Niemann, please pick as sphingolipidosis. So simply what he would do, he would actually pick a disease where there is deposition of sphingolipid. So Niemann would pick a disease as sphingolipidosis where there is actually a deposition of sphingolipid, which is specifically sphingomyelin. So you see the resemblance. Picking a sphingolipidosis should be sphingomyelin. So NiemannPick disease would be the first disease that someone like Niemann would pick, and there will be, in case of NiemannPick disease, there will be sphingomyelin accumulation, and it occurs due to deficiency of an enzyme called sphingomyelinase. The next disease that I want to remember well is Tay-Sachs disease. So I actually found a story in net in a forum which says like that. There was a boy who was named as Thay. So Thay was a boy who had a car which was a GM car, so General Motors car, and Thay had very poor vision. So poor vision meaning a red spot in macula, which is found in Tay-Sachs disease and also in NiemannPick disease. So Thay, the boy who had a GM car, had poor vision. But despite having poor vision, one night he goes out with his car and he drives like crazy. And on the way, he actually did an accident. And on this accident, a witch was injured, and the witch put a hex on him. And the hex was that whenever he tried to have sex with another person, his skin will form onion peels. So the story explains most of the important features of Tay-Sachs disease. So the name of the boy is Thay. So this is the Tay-Sachs disease. He had a GM car, General Motor car. So the substance that accumulates in Tay-Sachs disease is GM2 ganglioside. The boy had poor vision, meaning he had red spot on macula. And the boy, after injuring the witch, the boy had a hex on him. So the hex, meaning the enzyme that is deficient in Tay-Sachs disease, is called hexosaminidase A. And the hex was, whenever he tries to have sex with some person, his skin becomes like onion. So in case of Tay-Sachs disease, the people sometimes get onion skin lysosomes or onion peel lysosomes. So this is one way of remembering the most important features of Tay-Sachs disease. See, I didn't have any part here which tells you that this patient had hepatosplenomegaly or not. But in case of NiemannPick disease, the patient typically have hepatosplenomegaly. But the resemblance or the common things between NiemannPick and Tay-Sachs disease is red spot in macula. So whenever you see red spot in macula, you will just go for those 2 diseases, and the differentiation should be done by seeing if the patient has some features of hepatosplenomegaly or not. If the patient has hepatosplenomegaly, you will just pick NiemannPick disease. If the patient has no hepatosplenomegaly, you will pick Tay-Sachs disease. Next important disease is Gaucher disease. So Gaucher disease has the G, and this G is actually for glucocerebrosidase. So I'm just not making it things harder for you. So Gaucher disease, there is a G, so the accumulated substance is called glucocerebrosidase, which also has a G. Another disease, which is Krabs disease. So in case of Krabs disease, I like to write it in another way, which is, as you see, the name crab, it has two B's. So let us put something in between the B's, and one of the most natural instinct will be cra, then B, put in between B's some O's. So you can see we actually rewriting as Kraboob disease. So Kraboob disease, I wrote it in specific purposes. So in case of crab disease, there is actually accumulation of galactocerebrosidase. So you see, galacto means milk, and boobs produces milk. So you see there is a resemblance between Kraboob and galacto. So I think it might help you to remember the substance accumulated in Krabs disease. Okay, let's move forward. So the first and most important disease among lysosomal storage disease is Tay-Sachs disease. So in case of Tay-Sachs disease, there is deposition of GM2 ganglioside in different parts of the body, and GM2 ganglioside deposition in the brain leads to progressive neurodegeneration and delay in development. And very importantly, those patients have cherry red spot on macula and the lysosomes with onion skin. And most importantly, those patients does not have any hepatosplenomegaly. So as I previously mentioned, that NiemannPick disease also have cherry red spot in macula, but NiemannPick disease patient have hepatosplenomegaly. The deficient enzyme is hexose aminodase A. Accumulated substance is GM2 ganglioside, and most of the patients with lysosomal storage diseases have an autosomal recessive pattern of inheritance. So here goes the story again for you. So there was a boy named Ty who couldn't see well because of cherry red spots on his macula. One night, despite having bad vision, this retarded kid took his GM2, the car, out at night and crashed onto a witch. Before dying, the witch placed a hex, which is actually a curse, on him. So Ty means Tay-Sachs disease, cannot see well because of the cherry red macular spot. Took his GM2 car, meaning things that are accumulated in those patients are GM2 ganglioside. Retarded, meaning actually this doesn't go well totally, but you can remember retardation of developmental milestones like progressive neurodegeneration and delay of development. And hex, meaning hexose aminodase A, and the hex was skin would turn into onions every time he tried to have sex. So another important findings in Tay-Sachs disease is lysosomes with onion skins. So I think this story might help you to remember most important points about Tay-Sachs disease. Here you can see a fundoscopic view of macula, and here you can see the cherry red spot in the macula. So Gaucher disease is one of the most common among the lysosomal storage diseases. So Gaucher's disease, in case of Gaucher's disease, there is deposition of lipids which is in different parts of the body, including the liver and the spleen. And Gaucher disease has something very different from other diseases. In case of Gaucher disease, the patient can have bone marrow failure leading to pancytopenia. The patient can also have osteoporosis, and more importantly, patient can have aseptic necrosis of femur, bone crisis. And if someone does a liver biopsy, he or she will see Gaucher cell. So Gaucher cells are found on liver biopsy, which are actually lipid-laden macrophage that resembles like crumpled tissue paper. So the deficient enzyme in Gaucher disease is glucocerebrosidase, and accumulated substance is glucocerebroside. You can see the resemblance between the first letters. So in case of Gaucher disease, you have an accumulation of glucocerebroside. So I have a story for you that I brought from some place. So this story tells you that a fat Gaucher, fat meaning hepatosplenomegaly, Gaucher, which is actually a cowboy in some instances. A fat Gaucher who likes to eat sugar, which is glucose, tried to ride his horse but fell and broke his femur, meaning necrosis of femur and bone crisis. It was bleeding, so he put some crumbled tissue paper on it. So crumbled tissue paper meaning Gaucher cell that resemble like crumbled tissue paper. So you can treat patients of Gaucher disease with recombinant glucocerebrosidase, and it has like most other lysosomal storage diseases and autosomal recessive inheritance pattern. So here you can see the liver biopsy specimen showing you the Gaucher cell, which are crumbled tissue paper like. Actually those are lipid-laden macrophages. So next disease is NiemannPick disease. This is also very important. So NiemannPick disease has actually one differential, which is Tay-Sachs disease. So the most important difference between NiemannPick and Tay-Sachs is NiemannPick have hepatosplenomegaly. Tay-Sachs don't have hepatosplenomegaly, but both of them have cherry red spot on macula. And NiemannPick disease can also have foam cells, and like Tay-Sachs disease, the patient might have progressive neurodegeneration. And the deficient enzyme is sphingomyelinase, and accumulated substance is sphingomyelin. So as the story goes that I previously mentioned, if I ask someone who is named Niemann to peak as sphingomyelin sphingolipidosis, he will instantly peak a disease where there is actually a deficit accumulation of sphingomyelin. This is some common sense. He will peak that disease because it sounds good. And the pattern of inheritance is autosomal recessive. So here you can see some lipid-laden macrophages. So this is the nucleus, and the lipids are outside the nucleus. So Fabry disease is another disease. So I actually written Fabry disease with extra A. So the A does not exist normally, but I actually did that for some purpose. So Fabry disease or Fabry disease, in case of Fabry disease, you will have a neuropathy of hands and feet and angiokeratomas. So in Fabry disease, this is very specific lesion, which are actually benign lesions, skin lesions of capillaries resulting in red to blue color papules and characterized by hyperkeratosis. The patient might have cardiovascular or renal disease. So the enzyme deficient in case of Fabry disease is called alpha galactoside A. So what is bra? A bra is a clothing which actually covers your boobs. So what does boob secrete? Boob secrete milk. Milk is called galacto. So galacto is another name for milk. So Fabry, in case of Fabry disease, the patient have a deficiency of alpha galactosidase. So I think you might remember that from the name Fabry, bra, cover your galacto, cover your boobs. And in case of Fabry disease, you will also have angiokeratomas. So to remember that is, I put a sentence: put your bra when out in sun, cause you don't want to show your angiokeratomas that you have from Fabry disease. And the accumulated substance is ceramide trihexose. I actually don't have any mnemonic for that. And the inheritance pattern for Fabry disease is X-linked recessive. So this is very important because there are only two X-linked recessive lysosomal storage diseases, and I think you just have to know their name. Every other disease are autosomal recessive. So Fabry disease, bra meaning girls only wear bra, and girls have X chromosomes. So as you can see, you can easily remember that by that mnemonic that Fabry disease is actually inherited and an X-linked recessive pattern. Okay. So here you can see some typical lesions and distribution of angiokeratomas. Krabs disease, another disease, and you can write it not like Krabs disease, you can write it like Kraboob disease. So in case of Kraboob disease, the findings are peripheral neuropathy, developmental delay, optic atrophy, and very importantly globoid cell. So the globoid cells, you can write it in another way, globoid cell. So I'm just mumbling. So globoid cell. So boob, you see boob inside the globoid. So in case of Kraboob disease, you get globoid cells. So the accumulated substance in crab boob disease is galactocerebroside. So you see there is resemblance. So crab boob disease, so boobs secrete galacto, boobs means milk, milk means galacto. So in case of crab boob disease, you will have an accumulation of galactocerebroside, and the deficient enzyme is cerebrosides. And inheritance patterns, like most of the diseases, is autosomal recessive. So here there can be a confusion between Krabs disease and also Fabry disease, because I put kind of same type of mnemonics for that. But for crab boob, the accumulated substance is galactocerebroside, because I directly put the boob here. So boob directly accumulating galacto, so boob directly accumulating milk inside the boobs. And in case of Fabry, the deficient enzyme is alpha galactoside. So the people with Fabry disease does not have the bra, so they are actually does not have the galacto, because I don't know because of why. Maybe because they don't put a bra, their breasts are damaged or something like that. And as they don't put their bra, they are showing their angiochatomas. So in case of Fabry disease, you have a deficiency of alpha galactoside A. In case of crab boob disease, you have an deposition of galactocerebroside and also psychosin. So another important disease is metachromatic leukodystrophy. So here there is specific findings which are different from other disease. This is ataxia and dementia due to peripheral demyelination, very important. And the deficient enzyme is aryl sulfatase A, and accumulated substance is cerebroside sulfate. Okay, so this is the only disease that has an extra name of sulfate. So cerebroside sulfate, metachromatic leukodystrophy. Another important disease, which is mucolipidosis, is Hurler syndrome. So pay attention to the name, please. So in case of Hurler syndrome, what you have is called gargoylism. So Hurler, har. So I think you can remember it by the resemblance of the sounds. Har, gar. So in case of Hurler syndrome, you have gargoylism. So gargoylism is a specific somatic manifestation of the Hurler syndrome, where there is some musculoskeletal deformities involving the face, the arms, and the legs. And also you have corneal clouding. So those two are the most important finding in Hurler syndrome. And the accumulated substance, you can remember from the name that has H, the accumulated substance is heparan sulfate, so H. And the deficient enzyme is called alpha-1 iodoronides. And there can be deposition of mucolipids like heparan sulfate and dimeryl sulfate on liver and spleen also, so the patient can have hepatosplenomegaly. So here you can see musculoskeletal deformities associated with gargoylism, which are associated with Hurler syndrome. Another important mucolipidosis is Hunter syndrome. So here you can see again the H, so the accumulated substance is heparan sulfate, H, and also dimeryl sulfate, which is less important. And in case of Hunter syndrome, there will be features suggestive of Hurler syndrome, which will be mild. There will be aggressive behavior, because hunters have very aggressive behavior, Hunter syndrome, and the hunters can see very clearly, and that's why they don't have any corneal clouding. If you have corneal clouding, you might want to leave the profession of hunting. So you have to be very aggressive, and you have to have a very clear distant vision. And the deficient enzyme in Hunter syndrome is iodoronic sulfatase. And very importantly, Hunter syndrome is another disease which also have an X-linked recessive pattern of inheritance. Okay, so you can remember it. In case of Hunter syndrome, the hunters sometimes hunt girls, and girls have X chromosomes, so X-linked recessive inheritance. So the mnemonics that I've already put, hunters see clearly, so hunters don't have any corneal clouding, and aggressively aim for the X. So X may be a mark, like the X mark put on the bullseye, or X may be girls, X-linked recessive. And there is an increased incidence of Theis, NiemannPick, and some form of Gaucher disease in Ashkenazi Jews. So that's all from me today. Thanks for watching my video, and please give me your reviews.